Hello, anatomy colleagues. We have finally made it to regional anatomy with obviously a focus on musculoskeletal anatomy. So we're going to start with the skull, specifically the neurocranium, then we'll work our way through joints and muscles. We have a lot of learning objectives to work through. This is a large topic. The neurocranium is very complex. And we will begin with defining a few words and then we'll get into some actual structures. So we've all heard the words skull and cranium before, but do we really know what it means? The skull, you probably do. It is the entire bony skeleton of the head. So that includes the cranium, the facial skeleton, and importantly, the mandible and the jaw. Or the mandible is another word for the lower jaw. So the cranium, things get a bit more complex here because sources don't agree. If you're using Gray's Anatomy, the cranium is the neurocranium or the brain case. So this would include the calvaria, which is the skull cap or that dome-like roof, and the basicranium, which is the cranial base. So the major structure surrounding and protecting the brain. Now, some definitions of the cranium include the viscerocranium as well, but that would be a little confusing because then we would just be talking about the skull because it would include everything. Some definitions of the cranium is everything but the mandible. So a lot of discrepancies between the definitions of the cranium, and I don't want you to get too bogged down by that. I would rather you understand the terms like neurocranium, calvaria, basicranium, and viscerocranium. And the viscerocranium is going to be that facial skeleton. So let's start to work through the bones, starting with the most anterior bone of the neurocranium, and that is the frontal bone. Sometimes you hear this referred to as the forehead bone. So if you put your hand on your forehead, you feel the frontal bone deep to your skin. The frontal bone is an unpaired bone, although it did start off as two bones that fuse around 3 to 9 months after birth. Occasionally, there is a suture that will be retained called the metopic suture that could persist into adulthood. The frontal bone also is going to form the roof of the orbit, and the margin right above the orbit is called the supraorbital margin. And this margin can be built up in certain individuals, forming an almost shelf-like appearance, and it's just deep to about where the eyebrows are. Moving posteriorly from the frontal bone, you will have the paired parietal bones. These are fairly nondescript bones. They're really good examples of flat bones, and they will form the majority of the lateral sides as well as the roof of the calvaria. There are some muscle attachments on the parietal bones that will cause just a slight building of bone, but for the most part, these are fairly nondescript bones. So where the parietal bones are nondescript, the temporal bones are very much complex. They will be a portion of the lateral side of the calvaria, as is visible on this illustration, and a bigger portion of the cranial base. So let's focus on structures first that we can see from this lateral view of the calvaria, starting with the zygomatic process. And this articulates with the temporal process of the zygomatic bone. And when they articulate with one another, the whole complex is called the zygomatic arch. And if you can palpate your own zygomatic arch. It's just anterior to your ear, and you should feel a horizontal bar. On the posterior portion of the zygomatic process, there is an inferior projection that is called the articular tubercle. Some consider this a rounded elevation of the mandibular fossa, and who cares in terms of that description? It's all talking about the same thing. That mandibular fossa is going to be the articular surface for the TMJ. So this little area of bone is an important area clinically, And as a point of reference, because most dislocations of the temporomandibular joint have the mandibular condyle of the mandible moving anterior to the articular tubercle. So we know that is bad. It is moving outside of its normal place within this joint. So we want to keep that mandibular condyle posterior to the articular tubercle. So let's discuss this mandibular fossa a little bit more. This is going to be a depression, a smooth depression of bone just posterior to that articular tubercle. And this is considered the temporal portion of the temporomandibular joint. So this is the T in the TMJ. One of the most striking features of this lateral view is this spine-like slender projection called the styloid process. And why have a small projection kind of randomly coming down from the temporal bone here? Well, it's not random. This is going to be an area of attachment for ligaments and muscles associated with the tongue and the neck. And those muscles have names for that attachment. So it'll have a stylo in its name. So muscles like the stylohyoid or the styloglossus. There is another much larger inferior projection in this area called the mastoid process. If you can, palpate behind your ear and you can feel the mastoid process. And this area may look big and bulky, but it actually contains within several mastoid air cells, so just kind of pockets of air and kind of holes within the bone that are going to be considered air cells that can communicate with the middle ear. In fact, middle ear infections that go untreated can spread into this air cell region and it can cause inflammation and pain, and that is called mastoiditis. Now, we keep skipping this big hole right here in this region. So let's talk about what that is. Well, the opening is called the external acoustic, or sometimes you hear auditory opening. And the opening leads into the external acoustic meatus. And meatus means passageway. And that's exactly what this is, a passageway that allows sound waves to travel through this ear canal to reach the tympanic membrane, which is the scientific word for eardrum. So let's tunnel into this region a bit more and follow those sound waves. So we're following sound waves and we're tunneling to this region called the petrous part of the temporal bone. We will actually see this region a bit better when we're looking into the cranial cavity at the base of cranium. The petrous portion is unique as it is an area that houses the middle and the inner ear, and these portions contain important structures involved in hearing and equilibrium, as you can see on this illustration on the right. In fact, this is the only area in the body where bone has bone within. So the petrous part of the temporal bone houses the middle ear, and the middle ear has a pair, both middle ears have a pair of ear ossicles, which are the smallest bones of the body. In fact, the stapes is the smallest bone of the body. And these bones act as a bridge across the middle ear. They articulate with one another via synovial joints, and they transmit and amplify sound vibrations from the tympanic membrane to the inner ear, or specifically towards the cochlear region. And from lateral to medial, there's going to be the malleus, which its handle actually articulates with the tympanic membrane. It articulates with the incus, and the incus articulates with the stapes. And a portion of the stapes sits in a region called the oval window, which serves as a gateway between the middle and the inner ear. All right, that was a lot of time spent on that complicated temporal bone. Let's move to our most posterior portion of the calvaria and the majority of the posterior basicranium, and this is the unpaired occipital bone. The external Occipital protuberance is a prominent midline bump on the back of your head. You may be able to palpate this on yourself. Sometimes it's so large, and if an individual has their hair cut really short, you can actually see the projection beneath the skin. And this area of bone is built up because the trapezius has an attachment here, which is one of your large superficial back muscles. But there's also a structure called the nuchal ligament, which helps support the head. It extends from the external occipital protuberance all the way down to the seventh cervical vertebrae, give or take. Another important structure or structures are going, and this is also on the external surface of the occipital bone, are going to be the occipital condyles. These are kind of two oval or kidney bean shaped processes with convex surfaces. These are going to articulate with the first cervical vertebra to form the atlanto-occipital joint, which with its movements allows us to shake our head yes. These are located on either side of this giant hole called the foramen magnum, which we will discuss in more detail with the cranial fossa. The sphenoid is an unpaired butterfly or wedge-shaped bone that is located in the middle of the cranium. It's often called the keystone, particularly the basicranium, because it articulates with all the other cranial bones in that region. It does form a small part of the lateral wall of the calvaria, and it also forms a portion of the orbit, but the bulk of the sphenoid is located in the cranial floor, and it will be hugely important for the numerous foramina present on the bone that allows neurovasculature to enter and exit the skull. And we'll talk about those more when we talk about the cranial fossae. The unpaired ethmoid bone is similar to the sphenoid, but just on a much smaller scale. Just in terms of its location, it's one of the more unique looking bones in the body. It's very delicate, it's very complex. It has almost a sponge-like appearance because there's lots of little holes in there. It's a small part of the anterior basicranium, and it's located between the orbits, and it even forms the superior portion of the nasal septum. All right, let's turn our attentions to those cranial fossae that I keep talking about, and let's conceptualize this view. Imagine we remove the calvaria or the skull cap, and we're looking into the skull. So you're seeing the internal surface of the basicranium or the base of the cranium. And the shape of this region resembles the outer surface of the brain, and that makes sense because the bone forms around the brain. So we will have three cranial fossae, anterior, middle, and posterior. And you can see these are at different levels, kind of like stairs. You particularly see this well on this bottom illustration. So the anterior cranial fossa is going to be the highest layer, middle is intermediate, and the posterior is going to be the lowest or the deepest layer. So anterior, middle, posterior. So let's get into a bit more detail with these, starting with the anterior cranial fossa. It's formed primarily by the frontal bone anteriorly, and right in the midline is the ethmoid bone. And then posteriorly, you are going to have the lesser wings of the sphenoid bone. So it has quite a few bones forming it. Deep to the anterior cranial fossa are both the orbits as well as the nasal cavity. And the frontal lobes of the cerebrum of the brain sit here during life. So I said the ethmoid portion is complicated. You will have this projection here, kind of right in the midline called the crista galli. This will be an attachment point for a partition of meninges, but I want you to focus on all these small foramina, or all these small holes on either side. They're pinprick size. And this is where axons of the first cranial nerve, also called the olfactory nerve, from the nasal mucosa and the nasal cavity will pass through, bringing back information related to smell back to the brain. Things get a bit more complex with the middle and posterior cranial fossae, quite a bit more in terms of foramina. The middle cranial fossa is formed primarily by the greater wings of the sphenoid bone. And you're going to have the body of the sphenoid bone in the midline, also in the middle cranial fossa. The posterior boundary is going to be the apex, or kind of the top of the petrous part of the temporal bone, which is this rock-like portion of the temporal bone. Recall our previous discussion that the middle and the inner ear are housed within this portion of the temporal bone. The temporal lobes of the cerebrum are cradled in this region, and the pituitary gland is located more in the midline. And this middle region here is called the sella turcica, which is this saddle-shaped region here. And sella turcica literally translates to Turkish saddle. And the seat of this saddle is a depression called the hypophyseal fossa, right in that region, which contains the pituitary gland. So the pituitary gland sits in there. Another name for the pituitary gland is the hypophysis. So that is where this name comes from. All right, let's turn our attention to some openings. Again, we are not covering every single opening. It may feel like it, but there's quite a bit more. We're going to cover some of the bigger ones, starting with the optic canals, which allow for the optic nerves to pass through, or cranial nerve 2, that's traveling from the eye to the brain. You'll also have the vascular supply of the orbital region called the ophthalmic artery traveling through here. Now, the optic canal is sometimes included in the anterior cranial fossa, and I can understand why. It's right at that boundary, between lesser wing and the greater wing region. But I'm including it here because I want it to be associated with this other opening called the superior orbital fissure, which is going to be it's a rather large fissure, but it's often covered up by that lesser wing. So you have to kind of tilt the skull a little bit to see it. And it has so many structures moving through here. That's why it's so large. And these structures are all traveling to or from the orbit. The majority of these are innervating the extraocular eye muscles, or the muscles that move the eyeball. So these include the oculomotor nerve. The oculomotor nerve, or cranial nerve 3, is the one that does the majority, innervates the majority of the extraocular eye muscles. But also the trochlear and the abducens both innervate one extraocular eye muscle. The ophthalmic division of the trigeminal nerve is a purely sensory nerve, so it's bringing back information from the orbital region back to the brain, but this is not the special sensory for vision. That's more general sensory. The special sensory is coming from this optic nerve. Lastly, we have the posterior cranial fossa, which is going to extend from the apex of the petrous part back to the occipital bone region. And this is the deepest fossa because it cradles so much, including the cerebellum and portions of the brainstem, so the pons and the medulla oblongata. It's a pretty complicated region too, with lots of foramina. On the side of the petrous portion of the temporal bone, you have another acoustic meatus. Remember the external one, which was on the side of the skull? Well, this one right here is going to be the internal acoustic meatus. And that's going to take structures in towards the middle and the inner ear. The facial nerve, or cranial nerve 7, will enter into the internal acoustic meatus, but it will eventually leave and exit the skull. Whereas cranial nerve 8, or vestibulocochlear nerve, will enter here and never come out of the skull because it serves structures in the inner ear. So if you break down the name, vestibulo is going to stand for that vestibular apparatus, which is important for equilibrium. And then cochlear is important in terms of hearing. So think cochlea. The jugular foramen is going to be located between the temporal and the occipital bones. It's usually oddly shaped. Not every jugular foramen looks the same. And it's due to the pressure differences that occur in the internal jugular vein, or the IJ one of the more important veins in the body. All of the deoxygenated blood from the cranial region eventually makes its way to this region and will drain through the IJV on its way back towards the heart. Nerves will also traverse the jugular foramen, including glossopharyngeal nerve, the vagus nerve, one of the most important cranial nerves, and then you'll also have the accessory nerve or cranial nerve 11. And we finally made it to the big hole, the biggest hole of the skull, which is the foramen magnum. Interestingly, this isn't the largest foramen of the body. That will actually be located in the hip bone with the obturator foramina. The major structure traversing this area is the transition between the medulla oblongata of the brainstem to the spinal cord. So the foramen magnum is that transition from brain to spinal cord. We'll also have the vertebral arteries ascending through the foramen magnum on its way to supply the brain. It's one of the major supplies of the brain. And then we also have the accessory nerve traversing here. But wait, I just said the accessory nerve goes through the jugular foramen. Well, both are true. The more traditional term for accessory nerve is actually the spinal accessory nerve. So it comes off the spinal cord right at that kind of transition area. It will ascend through the foramen magnum and then almost immediately go through the jugular foramen in order to exit the skull. Whew, that was a lot. This is one of the most complicated areas in the body, and you're going to have to spend more time reviewing here, and that's okay because it's one of the more important areas. We do need to spend a little more time here. So let's work through this question together. Which structure of the temporal bone has air cells within? You knew I would probably ask something about the temporal bone since it's so complex. Well, all of these answer choices are of the temporal bone, so we can't differentiate there. So we just got to start working through these. The articular tubercle is a small projection on the back of the zygomatic process. No air cells there. Important in terms of keeping the TMJ in the right place. So we're keeping those structures within. The internal acoustic meatus is a tunnel into bone. No air cells there. Mandibular fossa is the temporal portion of the TMJ, not the right answer either. The styloid process, just too slender to have much going on inside, so that's not correct. So that leaves us with the mastoid process, which is that wider inferior projection just behind the ear. There are small air cells within which communicate with the middle ear. So D, mastoid process is correct. Excellent. Thank you so much for your time and attention.